Good afternoon and welcome to our Oak Bend Medical Center Happy Hour podcast. My name is Donna and I am your host. I'm very excited to introduce our guest today as we speak about what to expect with abnormal mammogram. Dr. Stephen Thomas has been a breast specialist and practicing general surgeon since 1991. From the beginning, much of his practice has been dedicated not only to general medicine, but for caring for women with abnormal mammograms, fibrocystic changes, breast cancer, and other breast-related issues. Dr. Thomas offers personalized care in a supportive environment. He provides his patients with the most effective options for treatments of their diagnosis. Welcome, Dr. Thomas. We're so glad to have you.
Thank you, Donna. It's good to be here.
So I've been talking to women, including myself, and there's a fear about going and having your mammogram, and oh my goodness, it's going to be abnormal, and what am I going to do? And it just goes. So, what if you've gotten an abnormal mammogram? You're scared to death. What's next?
Well, and that's a very understandable feeling. But the first thing to realize is to understand that the vast majority of abnormalities on your screening mammogram are going to turn out to be nothing to be worried about. Usually we end up ordering some additional testing, which may show that some of the abnormalities shown on the mammogram are just overlapping tissue in the breast or nothing. Sometimes we end up doing an ultrasound, which will detect solid or cystic lesions in the breast. But over 90% of abnormalities seen on mammogram turn out to be nothing or benign.
I think the hardest part from when I've talked to other women is how soon you can get an appointment, because that is a horrible thing, sitting there waiting to find out what's next. In your clinic, how soon can you get an appointment?
Well, usual appointments are a day or two after you call, but in some situations we can get you in within an hour. We just need to know that you want to get in that quickly, and we'll see what we can do, but certainly within a day or two.
But it's not weeks or months?
No, definitely not.
That's very reassuring for our listeners, because that's kind of bad to have to wait that long. You mentioned that there are additional tests. What additional tests would I need, and do I have to go into the hospital for them?
So, well, the testings, at least the initial ones, would be like spot compression mammogram or an ultrasound. And those are done possibly in a hospital or an imaging center, but it's not a hospitalization. It's just a visit. If we get to the point where we may need to do a needle biopsy, which would be the next step after we don't rule out the abnormality or show that it's nothing that needs additional workup, the next step is usually a needle biopsy, either done under mammographic, which would be stereotactic, or ultrasound guidance. And again, that's just either a clinic visit. We can do a lot of the ultrasound guided biopsies in our office, or the radiologist can do the stereotactic biopsy, but it's not a hospitalization.
Dr. Thomas, what if it is cancer?
So in the rare instances that it is a cancer, then after we get the diagnosis, the first step is to get you into an oncologist who would do a further workup to hopefully show that it's a localized lesion. And then we determine as a group, the oncologist and you and I would talk about the next step, which sometimes is doing some chemotherapy initially and then surgery. And most of the time, though, it's surgery, possibly some chemotherapy or a pill that you would take for some time.
So I would assume early detection is the key.
Yes. I mean, the earlier we find something, the better. The higher chance we have of getting rid of it for good.
So what if I'm doing a self breast exam and I find a lump or something that doesn't feel right?
Mm-hmm.
When should I see a surgeon or where do I go? How do I start?
So you can start with your family doctor, or you can come see a surgeon at that point. We're the ones that are, used to working those types of things up and determining whether just an ultrasound or a mammogram or what's needed at that point. And if you come in to see me, then we can get it figured out pretty quickly and hopefully prove that it's nothing to worry about.
And do genetics play a part in breast cancer?
They definitely play a part in that if you have a strong family history, then you may do some genetic testing on the people in the family with cancer. The vast majority of breast cancers are found in women that do not have a genetic history or a family history.
Okay. So when does a woman start the whole mammogram thing?
So the general recommendations are to do a monthly breast self-examination starting, as a teenager. So an annual physician exam, and then starting at age 40, doing an annual mammogram, unless you find some abnormalities or something you need to check out further before age 40. Or if you have family history, strong family history, you may start earlier, 5 or 10 years before the person in your family that was diagnosed with cancer was found to have it. So the general guidelines are 40 years annual mammogram on up to possibly 75 or 80.
What is something in all your years of experience that you would want women to hear and know?
Just that doing your annual exam is the best way to catch something early and be able to get rid of it, and understand that just because you don't get tested doesn't mean that something's not getting started. And by the time you realize it, it may be too late to get rid of it.
Okay. Is there anything else that I'm missing that we haven't covered?
I don't believe so. It's definitely a very scary thing to get a call that you have an abnormal mammogram, but I've found that the quicker we can figure out that it's nothing to worry about, the better. And if there is something to worry about, then we can get to tackling it as quickly as possible and get you through it.
And in most cases, you can keep people right here.
Yep. Yes.
So they're
Absolutely.
not driving to the medical center or
Oh
anything, and
no.
they can
No.
get the same level, if not better care.
Yes. We can handle any breast abnormality right here at Oak Bend. We have Dr. Christopher Livingston, who's a plastic surgeon who's fantastic at breast reconstruction and other plastic surgical procedures that's available to help us out. We have Dr. Pogatia is an oncologist on campus, whichever oncologist you're comfortable using, but we have everything we need right here.
That is awesome. Now I'm going to throw a surprise at you. I have a guest today that wanted to come on, and she had her experience. And I think she ended up going to you, and she wants to share her story.
That'd be great.
Hi. So I'm currently in early 30s. And so I have a very prominent breast cancer on both sides of my family. And so I knew that I would probably needed to start having mammograms early. And so I went to do my mammogram. I wasn't expecting to get that call back to saying that your results came back abnormal. And, we needed to do some additional testing. And so, as most women who get that call, you get a lot of different feelings and things going through your head. Like I said, I became a Google doctor when I started Googling things on, breast cancer, signs, symptoms, things like that, because I wasn't necessarily having any issues with my breast, but I knew because of my family history, it was something that I needed to get done. And so I chose to go to Dr. Stephen Thomas, and my experiences was great. Like he said, they got me in pretty quickly to do my biopsy. And initially coming in the office, I was extremely nervous, but him and his staff, really made me comfortable with understanding the process and how the actual procedure was going to go. And he kind of soothed some of the anxiety that I had coming into getting the procedure and afterwards, was waiting for my results to come back. And so I highly, recommend Dr. Thomas. Him and his staff are wonderful, and they were great. And so anybody who's needing, to get those biopsies and things like that, definitely make sure that you reach out to Dr. Thomas' office. They would definitely take care of you.
Well, thank you very much. Thank you. Glad you had a good experience.
And good outcomes.
I did.
Congratulations,
Good
Mandy.
outcome. Thank you. Thank you.
I think it's just really important for everybody to understand that this can be detected early. And if you have questions, be safe versus sorry. Get with the physician. Dr. Thomas, you're an amazing guest. Love having you on. Would like to have you on some more. I know there's so many things that you can teach us. We will be posting Dr. Thomas's number. If you need to make an appointment, please do so. His staff is absolutely fabulous. Dr. Thomas, is there anything else you'd like to add?
Not that I can think of, but we're here and happy to help. Appreciate being on.
Well, thank you for joining us today, and a big thank you to our listeners for tuning in. Beginning now, set an intention and a relentless focus on living your life as the greatest person you can be in all situations. Please join us next week.
Thank you for joining us today on Oak Bend Medical Center Happy Hour podcast. We hope you enjoyed today's broadcast and invite you to email us at oakbendhappyhourpodcast@obmc.org with any questions or topics that you would like for us to cover. Remember, you can find us here each Friday at 5. Until next week, be mindful and stay healthy.